Hi, I'm Professor Steve Fink, and this is our short introduction to the subject of diabetes. So we scroll down. Here is the a brief lecture outline as the introduction. You might wish to print it out. We've indicated that 90% of people with diabetes have what's called the type 2 insulin-independent diabetes mellitus. As I described more in greater detail in other videos listed below, this means that their pancreas does produce insulin, but they have developed what's called insulin resistance. It is controlled with diet, exercise, and using oral hypoglycemics, such as metformin. That's the most common drug used to manage type 2 diabetes. We've given, listed here, a number of signs and symptoms of diabetes that I go into in much greater detail in the videos listed below. Under oral health considerations, generally it is advised that diabetic patients have morning appointments because they are less at risk, having just eaten breakfast, hopefully, to suffer from hypoglycemia and have hypoglycemic shock and faint. You should ask them, however, whenever their appointment is, when their last meal was. It is advisable to ask the patient to, if they have a glucose meter, to bring it with them so that their blood sugar level can be tested. Make sure that it's within the normal range. Again, I talked more extensively about that in the videos below. You should always have some oral fast-acting sugar, a candy of some sort, to raise their blood sugar level in case they do become hypoglycemic and start to go into hypoglycemic shock. Diabetic patients commonly exhibit periodontal disease, gingival proliferations, abscesses, xerostomia, increased risk of candida, numbness, burning mouth syndrome, and pain in the oral cavity, all related to poor circulation due to these elevated blood sugar levels. And again, I speak more extensively about that below. Oral health effects related to diabetes include xerostomia, gingival proliferation, periodontal disease, abscesses. I think we just pretty much said that already. Okay, as we scroll down, there are 3 videos that cover diabetes. These are from actual lectures given in a pharmacology course. The first one reviews the pathophysiology of diabetes. The second video covers oral anti-diabetic drugs, hypoglycemics, such as metformin, and which is a biguanide, as well as the sulfonylureas. If you want to review your knowledge on oral hypoglycemics, I would recommend that you watch that video, or at least parts of it. And then the third final video of these 3 is my review of insulins and the different types of insulins and how that all works. The lecture outline that I refer to in these videos is available right here. You can click on where it says 19 anti-diabetic drugs PDF. This is a downloadable PDF file. You can print it out and follow along with the detailed videos. So that concludes the brief introduction and review of diabetes. And hope you'll watch at least one or more of those diabetic videos for a review and better understanding. And we'll see you in the next video.